Most people do not know what the condition hip dysplasia is because of the fact that it is cured quickly and does not show in later teen years or older. Look at me, for example. I run cross-country, track, and am very active. You would have never guessed that I had hip dysplasia when I was born. Development dysplasia of the hip, or hip dysplasia, is a condition of the hip joints that is very common. In mild cases, some ligaments or other soft tissues are not tight around the hip joint, so the femur moves around more than normal. In more severe cases, the joint is just loose enough to let the ball of the femur pop halfway out of the socket. The most severe form of hip dysplasia is dislocation. This means the ball at the top of the femur fully pops out of the hip socket. The first main point I will be talking about is the diagnosis of hip dysplasia. Next, I will talk about its symptoms and causes, and lastly, I will talk about how it can be cured. Understanding hip dysplasia and its symptoms can help you better realize the problems your newborn baby could acquire. In fact, this diagnosis of the condition can be found in as early as a newborn baby. The most common time to find hip dysplasia is when your newborn baby has his or her first physical exam. According to the International Hip Dysplasia Institute, approximately 1 out of 20 full-term babies have some sort of hip instability. If the child is older, it could be found in a well baby checkup. The doctor examines the newborn's baby hips by using the Barlow's test. This test is when the doctor bends the baby's hips toward itself and then outward. If the doctor feels a clunk or a clinky hip, the hip is most likely out of place and is a good sign the baby has hip dysplasia. Another way to diagnose this condition would be by using ultrasounds or x-rays. After being diagnosed, it is important to understand the causes and symptoms of this condition. The cause of development dysplasia of the hip is unknown, but some risk factors may be the cause. If there is a family history of this condition or the baby is positioned in a certain way in the womb, it could raise the chances of the baby's hips not forming correctly. One good thing about hip dysplasia is that there is no pain. The baby can experience other noticeable symptoms, however. In newborns, one of the baby's legs may seem shorter than the other. There could also be extra folds of skin on the inside of the thighs. When the child is walking, there could be a limp. They could also walk on the toes of one foot while the other foot is laid flat, attempting to make up for the difference in leg length. Once the parent has noticed these symptoms, they need to be treated right away. The only way to cure hip dysplasia is by treating it. According to WebMD, the most common way to cure a baby less than 6 months old is by using a Pavlik harness. This harness has fabric straps that fit around the baby's chest, shoulders, and legs. It holds the newborn's thighs up and out. Most of the time, this harness fixes the hips. However, if the doctor does not see improvement, the harness is removed and other treatments are offered, like surgery. Few children need this surgery, though, which is good because of how costly it could add up to be. This procedure repositions the thigh bone or femur and sometimes even reshapes the socket. Another way to treat this condition is by getting a spica cast. This cast is made of plaster or fiberglass and forms over the waist, hips, and legs. Sometimes a bar is even added in between the legs to make the cast stronger. According to the American Academy of Orthopedic Surgeons, if hip dysplasia is left untreated, it can lead to pain and osteoarthritis by early adulthood. There could also be a difference in leg length and decreased agility. Hopefully knowing how to cure hip dysplasia can help you recognize why a baby or a toddler could be wearing a cast or a brace. After knowing the facts about development dysplasia of the hips, you can better understand this common hip condition. The most common way to diagnose hip dysplasia is during the newborn's first physical exam or the next well baby checkup. After knowing you have this condition, most of the symptoms are the same in many cases. There is no way to fix this condition without getting treatment from a cast or a brace. Fully understanding what hip dysplasia is makes it easier to identify and detect in newborn babies or children walking with a limp. This condition may not seem very serious, but knowing it could happen to anyone is a major issue.